Welcome to the deep dive. Today we're going behind the scenes of emergency medicine.
Oh, okay.
Yeah, exploring the world of behavioral disorders from a paramedic's perspective.
Interesting.
We've got some fascinating case studies and test questions
Oh, wow.
taken straight from a paramedic textbook. The kind of stuff that really makes you think.
Yeah, these aren't just abstract medical scenarios.
Right.
We're talking about real-life situations that paramedics encounter every day.
Yeah.
Situations where understanding human behavior can be just as crucial as knowing medical procedures.
Exactly. And
Yeah.
you'll see how the lines can blur when it comes to behavioral emergencies.
For sure.
We're gonna delve into cases involving potential suicide, extreme agitation,
Yeah.
even situations where restraint becomes necessary.
Restraint. Yeah, that's always a tough one.
That is.
What's fascinating is that each case presents unique challenges, ethical dilemmas,
Right.
and opportunities to learn.
Yeah.
It's about more than just treating symptoms. It's about understanding the whole person in crisis.
Yeah, let's start with a case that really highlights the complexities of scene assessment.
Okay.
Imagine this.
Okay.
A 16-year-old boy
Okay.
found by his father hanging in his closet.
Oh, gosh. It's a scene filled with chaos and grief.
Right?
The boy is unconscious. His skin is turning blue.
Oh, wow.
And there are fluids on his chest and abdomen.
Oh, my God.
The father, who's already started CPR, tells the paramedics he found his son with padding under the tie around his neck.
That detail about the padding, it immediately raises questions, doesn't it?
It does.
In a situation that seems like a clear-cut suicide attempt, that one detail throws everything into question.
It does, and it forces paramedics to consider a difficult possibility.
Okay.
Autoerotic asphyxiation.
Oh.
It's a phenomenon where individuals accidentally die during solitary sexual acts that involve intentionally restricting oxygen flow to the brain.
Wow.
The presence of padding suggests this might be the case rather than a deliberate attempt to end his life.
That's such a sensitive and often misunderstood topic.
Yeah.
I imagine it takes a lot of training and experience for paramedics to even consider that possibility,
It does.
especially in the midst of such a charged situation.
It does, and they have to balance their investigation with incredible sensitivity towards the grieving father.
Right.
Can you imagine the guilt and confusion he must be
I
experiencing?
can't even imagine.
Paramedics need to be careful not to add to that burden by jumping to conclusions.
Absolutely. It's about gathering all the information,
Yeah.
considering every angle, but
Yeah.
also treating everyone involved with compassion and respect.
Right now, in this case, they learned the boy had a history of asthma
Okay.
and was on medication.
Okay, so that adds another...
That adds another layer of complexity.
Could an asthma attack have somehow mimicked the symptoms of hanging?
Yeah, it's a question that highlights the importance of differential diagnosis.
That's where paramedics have to become medical detectives,
Yeah.
right? They have to look beyond the most obvious explanation and consider all the potential factors at play.
Precisely. They have to connect the dots, considering the boy's medical history,
Uh-huh.
the specific details of the scene,
Yeah.
and all the possible explanations for his condition.
And in this case, they also had the boy's ECG readings to consider.
Right.
Initially, it showed pulseless electrical activity,
Oh,
or PEA.
PEA.
Can you explain what that means for those of us who aren't medical professionals?
Sure, think of it this way. His heart was essentially quivering,
Okay.
not pumping blood effectively.
Wow.
It's a very serious condition.
Yeah.
Later, his ECG progressed to a systole,
Okay.
which is essentially a flat line,
Right.
no electrical activity at all.
So they're dealing with a young patient, a potential hanging,
Right.
a distraught father,
Yeah.
and a complex medical situation all at the same time.
Yeah.
It really emphasizes the weight of responsibility these paramedics carry.
It does, and that was just our first case.
Oh my gosh.
Ready to move on to a scenario that's completely different.
Absolutely. What do we have next?
This time we're called to a scene where police have restrained a 48-year-old man who is manic and aggressive.
Okay.
He's exhibiting erratic behavior, struggling against the restraints,
Oh, wow.
and lashing out verbally at anyone who comes near.
That sounds incredibly intense, even dangerous.
Yeah,
I can only imagine how challenging it is for paramedics to approach a scene like that.
it is, and it presents a whole different set of challenges compared to our first case.
Right.
When a patient is already restrained by police, paramedics have to be extremely cautious.
Yeah.
The risk of injury is high,
Yeah.
both for the patient and the responders.
Right, because you're walking into a situation that's already highly charged.
Yeah,
de-escalation must become the top priority.
It is, but at the same time, paramedics need to quickly assess the situation
Okay.
and determine the root cause of the behavior.
Right.
Is it stemming from a medical condition, a psychiatric condition,
Yeah.
or a combination of both?
It's like trying to solve a puzzle while also managing a potentially volatile situation.
Yeah.
What was this man's background? Do they know anything about his medical history?
They did. He had a known history of bipolar disorder
Okay.
and was on medication.
So, judging by his behavior,
Yeah,
it seems likely he was in a manic state at that moment.
it seems that way.
Is there a way for paramedics to confirm that suspicion quickly,
Yeah.
even in such a chaotic environment?
There are certain physical signs that can point to mania.
Okay.
In this case, his vital signs were telling.
Okay.
Elevated blood pressure
Uh-huh.
and rapid pulse indicated a heightened state of arousal.
Okay.
His dilated pupils and sweaty skin were further signs of his agitated state.
So even in a situation where the patient isn't communicating clearly,
Right.
their body is sending signals that paramedics can interpret.
Exactly. It's about being attuned to those subtle cues,
Mm-hmm.
reading the situation,
Yeah.
and responding appropriately.
So how did they approach treating him? What's the best course of action when you're dealing with a patient who's already restrained
Yeah.
and exhibiting such extreme behavior?
The restraints were already in place,
Okay.
which helps ensure everyone's safety.
Mm-hmm.
But verbal de-escalation techniques are also crucial in these situations.
Okay.
Speaking calmly, validating the patient's feelings, and explaining what's happening can go a long way in reducing agitation.
It's almost like a delicate dance, isn't it?
It is.
Balancing the need for control with the need for compassion.
It is. And in some cases, medication might be necessary to help calm the patient down.
Okay.
But it's not a decision to be taken lightly.
Right, because you have to weigh the potential benefits against the potential side effects and the patient's right to autonomy.
Exactly. It's a complex ethical dilemma that paramedics often have to grapple with in the field.
Now, before we move on to our final case for today,
Okay.
I want to touch on something you mentioned earlier,
Sure.
the cyclical nature of bipolar disorder. What does that mean for paramedics who might encounter the same patient again in the future?
That's a great question.
Mm-hmm.
It's important to remember that bipolar disorder isn't a static condition.
Okay.
Even if this patient is stabilized and seems cooperative now, he could experience another manic episode
Mm-hmm.
or swing into a deep depression down the road.
So it's not just about addressing the immediate crisis, but also understanding the long-term trajectory of the illness
Right.
and the ongoing challenges the patient might face.
Exactly. It's about seeing the patient as a whole person, not just a collection of symptoms.
With that in mind,
Yeah.
let's delve into our final case.
Okay.
One that raises some serious questions about the way individuals with behavioral disorders are sometimes handled.
Okay.
We're talking about a 34-year-old man who was subdued by police after acting bizarrely and aggressively.
Okay.
When paramedics arrive,
Yeah.
he's unconscious, has abrasions, and his skin is showing signs of cyanosis,
Oh.
that bluish tint that indicates a lack of oxygen.
This case is particularly tragic because it highlights the potential for harm when restraint practices are misused and misunderstood.
Yeah.
The fact that this man was found lying face down immediately raises red flags.
Because that position can restrict breathing
Exactly.
and potentially lead to positional asphyxia,
Yes.
which can be fatal.
Exactly. It's a risk that paramedics are acutely aware of,
Right.
especially when dealing with patients who have been restrained.
Uh-huh.
Unfortunately, there's a dark history associated with restraining people face down,
Okay.
particularly a practice called hog tying,
Right?
which thankfully is avoided in modern emergency medicine due to its extreme dangers.
It's disturbing to think that such a dangerous practice was ever considered acceptable.
I know.
What are the preferred methods for restraining a patient safely and humanely?
It's all about minimizing the risk of harm while ensuring everyone's safety.
Okay.
Soft restraints applied to the wrists and ankles are generally considered safer,
Yeah.
and the patient should never be placed in a face-down position.
Makes sense.
Constant monitoring is essential to ensure their airway remains open and that they're not experiencing any distress.
So back to this specific case.
Okay.
What else did the paramedics know about this man's background?
He had a history of schizophrenia,
Okay.
a complex mental disorder that can involve a range of symptoms, including hallucinations,
Uh-huh.
delusions, disorganized thinking, and social withdrawal.
Wow.
It's important to note that not everyone with schizophrenia experiences the same symptoms or severity of symptoms.
So there's no one-size-fits-all approach to caring for these patients.
Exactly.
Each encounter requires a personalized assessment and response.
Exactly. And in this case, it was crucial for the paramedics to understand his specific presentation, his medical history,
Yeah.
and the medications he was on. He was taking Risperdal and Zyprexa, both antipsychotic medications, and CNO, an anticonvulsant, sometimes used to manage agitation. These medications can have side effects, so it's important for paramedics to be aware of potential drug interactions or complications.
Now, his ECG readings also revealed some concerning information.
Oh.
Initially, he presented with PEA,
Okay.
similar to the first case we discussed. But after resuscitation efforts, it progressed to normal sinus rhythm,
Good.
or NSR, with PACs, which are premature atrial contractions.
Cox, can you break that down for us? What does it all mean?
The initial PEA is a serious sign indicating that his heart wasn't pumping blood effectively.
Wow.
It's likely this was brought on by the positional asphyxia he experienced while restrained.
Right.
The fact that his heart rhythm returned to normal after resuscitation is a positive sign.
Okay, good.
But the presence of those PACs, those extra beats, suggests there might be some underlying cardiac irritability.
So even though he was revived, it doesn't mean he's out of the woods.
Right.
There could be lingering effects from that period of oxygen deprivation. Precisely. And it underscores the need for thorough post-resuscitation care and ongoing monitoring.
Right.
These patients require careful observation to ensure they don't experience further complications.
We've covered a lot of ground with these three cases,
We have.
each one highlighting a different facet of behavioral emergencies.
Yeah.
What are some of the key takeaways we should keep in mind?
I think the overarching theme is that behavioral emergencies are complex,
Yeah.
multifaceted situations.
Right.
They demand not only medical expertise, but also a deep understanding of human behavior, empathy,
Yeah.
and a commitment to providing ethical, compassionate care.
It's about recognizing that these aren't just medical cases. These are real people in crisis,
Yeah.
each with their own unique story and set of challenges.
Absolutely. And paramedics are often the first line of support for these individuals.
Right.
They need the training, the resources, and understanding to navigate these challenging situations and provide the best possible care.
We've just scratched the surface of these cases,
We have.
and I'm sure you're eager to hear more about their implications and the lessons they hold.
I am. So let's revisit that first case, the 16-year-old boy found hanging.
Okay.
The textbook asks a pointed question
Okay.
that really gets to the heart of this case. What was significant about the patient's positioning, the padding under the tie around his neck?
Yeah, the padding stands out as a really unusual detail.
Right.
It's something you wouldn't expect to see in a typical suicide scenario.
Exactly. And that's why it's so crucial for paramedics to pay attention to those seemingly small details.
Right.
The presence of padding along with the specific positioning could suggest autoerotic asphyxiation,
Right.
where the goal isn't suicide, but to heighten sexual pleasure through oxygen deprivation.
It's a difficult concept to grasp, especially in such a tragic context.
Yeah.
And I imagine it adds another layer of complexity for the paramedics who are trying to determine what happened.
They have to consider all possibilities while remaining incredibly sensitive to the family's grief.
Right.
Imagine trying to explain this delicate concept to a father who just found his son.
Yeah.
It requires a level of empathy and communication skills that goes beyond just medical knowledge.
Absolutely. It's about acknowledging the human element in all of this, not just focusing on the technical aspects of the case.
Right now, the textbook also challenges us to think about the differential diagnosis in this case.
Okay.
What else could have caused the boy's condition besides hanging or autoerotic asphyxiation?
His history of asthma immediately comes to mind.
Okay.
Could an asthma attack have led to a loss of consciousness and eventually cardiac arrest?
That's a possibility the paramedics have to consider. Asthma attacks can be severe, especially if they're not managed properly.
Right.
And the symptoms, difficulty breathing, turning blue, can overlap with what we see in a hanging scenario.
So even in a situation that seems straightforward at first glance, there's a lot of detective work involved.
Exactly. Paramedics are trained to look for those subtle clues,
Yeah.
to consider all the potential factors, and to never jump to conclusions.
Let's move on to our second case. The 48-year-old man exhibiting manic behavior who was restrained by police.
Right.
This one raises some interesting questions about how to manage a patient who's already in a highly agitated state.
It's a high-stakes scenario, for sure. The textbook asks a very direct question: why is the patient presenting with aggression and bizarre behavior?
Well, his diagnosis of bipolar disorder certainly seems relevant here. Could you explain how bipolar disorder can manifest in such extreme behavior?
Bipolar disorder is characterized by those extreme shifts in mood, from mania to depression.
Right.
During a manic episode, individuals can experience racing thoughts,
Okay.
heightened energy, impulsivity,
Yeah.
and even psychosis, which can explain the bizarre behavior and aggression we see in this case.
So it's not simply a matter of someone being difficult or uncooperative.
No.
There's a biological basis for their behavior, a chemical imbalance in the brain.
Precisely. And it's essential for paramedics to understand that context when they're approaching a patient like this. They need to recognize that the behavior isn't intentional or malicious. It's a symptom of a complex neurological condition.
Now, the textbook also asks about the best approaches for dealing with a manic patient versus a depressed patient. It seems like those would require very different strategies.
Absolutely, when dealing with a manic patient like the man. In this case, the priority is de-escalation.
Oh, okay.
Speaking calmly, validating their feelings, and avoiding confrontation can help reduce agitation.
But wouldn't that be challenging when the patient is already restrained and potentially struggling against those restraints?
It can be,
Yeah.
and it requires a delicate balance of ensuring safety while also respecting the patient's dignity.
Right.
Sometimes simply acknowledging their distress and explaining what's happening can make a difference.
What about medication? Would that be a consideration in this situation?
It could be if the patient is a danger to themselves or others, or if their mania is so severe that it's preventing them from receiving necessary care. Medication might be administered, but it's not a decision to be taken lightly.
Right, because medication can have side effects, and you have to consider the patient's autonomy as well.
Exactly. It's a complex ethical dilemma that paramedics often face in the field.
Right.
They have to weigh the potential benefits of medication against the potential risks and the patient's right to refuse treatment.
Now, you mentioned earlier that bipolar disorder is cyclical,
Yes.
meaning that manic episodes can be followed by depressive episodes.
Right.
How does that impact the way paramedics approach a patient with bipolar disorder?
It means they need to be aware that the patient's presentation can change dramatically from one encounter to the next.
Right.
Someone who is manic and agitated today could be withdrawn and lethargic tomorrow.
So it's not just about addressing the immediate crisis, but also recognizing that this is a long-term condition that requires ongoing care and support.
Precisely. And it underscores the need for communication and collaboration between paramedics, mental health professionals, and other support systems in the community.
Let's move on to our final case. The 34-year-old man with schizophrenia who was found unconscious after being subdued by police.
Okay.
This one raises some serious concerns about the use of restraints and the potential for harm.
This case is a stark reminder of the responsibility that comes with restraining a person, especially someone experiencing a mental health crisis.
Yeah.
The textbook asks a very pointed question: should hog tying be utilized in the field for patient restraint?
Okay.
And the answer is a resounding no.
That seems pretty definitive of what makes hog tying so dangerous.
Hog tying involves binding a person's hands and feet together behind their back,
Yeah.
often in a face-down position.
Right.
It severely restricts breathing and can quickly lead to positional asphyxia, which is exactly what happened in this case.
It's disturbing to think that such a dangerous practice was ever used.
Yeah.
What are the preferred methods for restraining a patient safely?
It's all about minimizing the risk of harm, while ensuring everyone's safety soft restraints applied to the wrists and ankles are generally considered safer, and the patient should never be placed in a face-down position.
That makes sense. It's about finding that balance between protecting the patient and protecting those around them.
Exactly, and constant monitoring is crucial. Paramedics need to constantly assess the patient's breathing circulation and overall well-being to ensure the restraints aren't causing any harm.
So in this case, the patient had a history of schizophrenia. Could you explain a bit more about that condition and how it might have contributed to his behavior?
Schizophrenia is a complex mental disorder characterized by a range of symptoms, including hallucinations, delusions, disorganized thinking, and social withdrawal. It's important to remember that not everyone with schizophrenia experiences the same symptoms or severity of symptoms.
So there's no one-size-fits-all approach to caring for a patient with schizophrenia.
Exactly. Each encounter requires a personalized assessment based on the individual's specific presentation and needs. In this case, the paramedics needed to understand the man's history, the medications he was on, and the specific triggers that might have led to his crisis.
His medications included Risperdal and Zyprexa, which are antipsychotics, and CNO, which is sometimes used to manage agitation. What should paramedics know about these medications when they're treating a patient with schizophrenia?
It's essential to understand that these medications can have side effects, and some can interact with other drugs. Paramedics need to be aware of those potential interactions and be prepared to manage any complications that might arise.
Now, his ECG readings also painted a rather complex picture. He initially presented with PEA, which we discussed earlier, then progressed to a normal sinus rhythm with PACs after resuscitation. What can we learn from that?
The initial PEA is a serious sign indicating that his heart wasn't pumping effectively. It's likely this was a result of the positional asphyxia he experienced. While restrained, the fact that his heart rhythm returned to normal after resuscitation is a positive sign. But the presence of those PACs, those extra beats, suggests there might be some underlying cardiac irritability.
So even though his heart rhythm stabilized, it doesn't mean he's out of danger. There could be lingering effects from that period of oxygen deprivation.
Precisely. It highlights the importance of thorough post-resuscitation care and ongoing monitoring. These patients need close observation to ensure they don't experience further complications.
We've explored these three cases in depth, uncovering the layers of complexity that paramedics face when responding to behavioral emergencies. As we move into the final part of our deep dive, what are some key themes that have emerged from these discussions?
I think the overarching message is that behavioral emergencies are rarely straightforward. They demand a unique blend of medical knowledge, compassion, and critical thinking skills.
It's not just about treating the symptoms, it's about understanding the person behind the crisis.
Absolutely. And as we delve deeper into the questions posed by the textbook and explore the broader societal context, we'll see how these themes play out on a larger scale.
We've laid the groundwork with these cases, and now it's time to expand our perspective and explore the bigger picture. Stay tuned for the final part of our deep dive. So we've explored the medical complexities of these cases, the diagnostic challenges, and the ethical considerations. But now I want to shift our focus to the human element, to the individuals behind the diagnoses. These aren't just textbook examples. These are real people experiencing real crises.
Yeah, it's so easy to get caught up in the technical details and forget that we're dealing with human beings who are often scared, confused, and in desperate need of understanding.
The textbook we've been using really emphasizes that point by asking questions that go beyond the purely medical. For example, in the case of the 16-year-old boy found hanging it asks, what is this act of self-gratification commonly labeled by law enforcement agencies?
And the answer can be quite jarring. Autoerotic asphyxiation is often misconstrued as suicide or even homicide without clear evidence to the contrary. Law enforcement might jump to conclusions that further traumatize the family and misrepresent what truly occurred.
It's a stark reminder that assumptions can be dangerous, especially in these sensitive situations. It highlights the need for thorough investigation, open communication, and a willingness to consider all possibilities.
Absolutely. And the textbook also delves into the emotional impact on those involved, particularly the father who found his son, it asks. What is difficult for the father and others affected by this incident?
I can only imagine the guilt, the confusion, the grief compounded by the social stigma surrounding such a death.
It's a heavy burden to carry, and paramedics, who are often the first to arrive on the scene, play a crucial role in providing support that goes beyond medical.
It's about recognizing the emotional turmoil the family is going through, acknowledging their loss, and offering a sense of humanity amidst the chaos.
Exactly. It's about treating them with dignity and respect, even in the midst of a difficult investigation.
Now, the second case, involving the man with bipolar disorder, also prompts us to think about the long-term management of this condition, the textbook asks. What are the classifications of the patient's medications? What are the best approaches for dealing with a manic patient versus a depressed patient?
Yeah, it's emphasizing that this isn't just a one-time encounter. Paramedics might encounter this individual again, perhaps during a depressive episode, which presents a whole different set of challenges.
So it's not just about addressing the immediate crisis, but also recognizing that bipolar disorder is a chronic condition that requires ongoing care and understanding.
Precisely, and the approach to a manic patient who might be agitated and unpredictable will differ significantly from the approach to a depressed patient who might be withdrawn and lethargic.
It underscores the need for paramedics to be adaptable, to tailor their responses to the specific needs of each patient at each encounter.
And to recognize that mental health is a spectrum, not a fixed point. People can move along that spectrum, and their needs will change over time.
Finally, the case of the man with schizophrenia who is restrained face down raises some broader societal questions. The textbook asks, what is agitated delirium? What is schizophrenia? Should hog tying be utilized?
It's prompting us to examine how we as a society respond to individuals experiencing mental health crises. Agitated delirium, characterized by extreme agitation and often aggression, can be incredibly frightening for both the individual and those around them. But the use of excessive force or dangerous restraints like hog tying is never the answer.
It speaks to the need for better training for law enforcement and first responders training that emphasizes de-escalation techniques, mental health awareness, and the appropriate use of restraints.
We need to shift from a culture of control to a culture of care when it comes to interacting with individuals with mental health challenges. This includes recognizing the signs of a crisis, understanding how to communicate effectively, and knowing when to call for medical assistance.
We've covered a lot of ground in this deep dive. We have explored the medical intricacies of behavioral emergencies, delved into the ethical dilemmas faced by paramedics, and examined the broader societal context of mental health care. What's the lasting message you hope our listeners take away from this?
I think it boils down to this. We need to approach behavioral emergencies with both our heads and our hearts. We need to be clinically competent, of course, but we also need to be compassionate, understanding, and truly present for those in crisis. We need to see beyond the diagnosis and recognize the individual human being who deserves our care and respect.
That's a powerful call to action. We can all play a role in creating a more supportive and empathetic world for those struggling with mental health challenges. Thanks for joining us for this insightful deep dive, and until next time, keep those minds curious and those hearts open.